Alright, I am Dr. S. As we have completed our pulmonary section in medicine, now we will discuss all the pulmonary cases that we will be looking in a surgical unit. So today we are going to discuss a pulmonary case of surgery in this city, right in front of a city of a patient who had injury and came in emergency with increasing shortness of breath. He had an accident, motor vehicle accident, 8 hours ago. So after accident, he developed shortness of breath, and he was on oxygen. His saturation was 90. So after that, his initial chest X-ray was normal. So when we did his CT after 6 hours, there were peripheral anterior ground glass opacities on both lungs. So can you guess diagnosis on that case? And one of the finding of that disease or that you can see abnormality is also in this picture. The picture you are seeing in this city is classic for that finding. So I give you brief history. So can you guess diagnosis? I give you 5 seconds. So I repeat, a patient came in emergency with increasing shortness of breath. He was having an accident, motor vehicle accident 6 hours ago. His initial chest X-ray was normal. But when a CT did, there was a pestis. So can you guess diagnosis now? Yes. So this patient is having a classic finding. This one. This is a CT chest. So that you can see the finding. This is irregular, nodular apostosis. You can see this one all over here. So this is classic for pulmonary contusion, right? So this was a classic case for pulmonary contusion. So whenever you have an emergency and you see a patient who's having a trauma and he developed a ground glass opacities less than 24 hour, remember he is having a pulmonary contusion. So whenever a patient develop ground glass opacities and he is having a history of motor vehicle accident, you should suspect that this patient is having a pulmonary contusion until proven otherwise. So whenever, so this is a classic finding. So you will see that the ground glass appearance it can be also in RDS, respiratory distress syndrome. Remember, in respiratory distress syndrome, it will take greater than 24 hours opacity to develop, and opacities will be more than 24 hours. And another thing, it will develop between 24 hours to 72 hours. So it will take time. If it is less than 24 hours, it is 99% that this patient will be having a pulmonary contusion. So this was a classic case of pulmonary contusion. Remember, non-lobular infiltrate on X-ray or CT scan whenever you see, you should be suspecting pulmonary contusion.